Thank you so much, John. As National Volunteer President, it's exciting to have this opportunity to discuss our important launch of this educational campaign. What I'm going to review are some of the rationale for our pursuing this Access to Care initiative as we're doing, and how we're framing this issue through the cancer lens. I'll also discuss some of the tools that we've developed to help frame the debate about access to care. Well, there's some good news. We are seeing progress in the fight against cancer. Cancer mortality rates have been declining since 1991. We've done this through improved prevention and early detection, and we've extended survival through improved treatment. The bad news, however, is that cancer remains a major public health issue in this nation, probably our most important public health issue. In fact, it is the leading cause of death for individuals under age 85 in the United States. And the reality is that our healthcare system is simply not up to the task of providing timely, quality cancer care. If we fail to address access to that care, what we've proven works, what can solve the cancer problem, but if we do not allow everyone in this country to have access to that proven early detection, prevention, and treatment, we will fail to accelerate our progress in the cancer fight, and we even risk losing all the progress we've made. We believe that framing this issue through the cancer lens is the right way to go. The fact that 47 million individuals in this nation are without uninsurance creates a moral imperative for action. But the issue, as John said, is not confined to those individuals without insurance. Many people are underinsured, and these individuals also face critical dilemmas when they confront cancer. In fact, the nation, in a poll conducted by Roper Image Survey, stated that cancer is our number one public health problem. But not only that, they also perceive cancer as among the most important personal health problems that they could face. We believe that if we can demonstrate the impact of lack of access on the cancer problem, it will resonate with the country, and that it's the right way to go for the American Cancer Society to frame the access debate. We've conducted recent research. In fact, our own American Cancer Society researchers confirm what we've long suspected, that if you do not have insurance, you are far more likely to be diagnosed in an advanced stage. Uninsured breast cancer, oropharyngeal cancer patients, and laryngeal cancer patients are from 2.5 to 4 times more likely to be diagnosed at advanced stages of the disease, stages at which the likelihood of cure absolutely plummets. We've also known that individuals with cancer face significant impact on their ability to handle their financial demands. About 1/3 of cancer patients report difficulty paying their medical bills. Well, it's one thing to have difficulty in paying bills, but how does that translate to the likelihood of getting effective treatment? And the translation is powerful and significant, and risks someone who could be cured ending up not having that cure. In fact, nearly half of patients diagnosed with cancer report that they skip treatment, cut pills, or don't purchase medications because of the cost of that treatment. Even individuals with insurance discover when they confront cancer that although they have non-insurance, they do not have adequate coverage. They report difficulties in having their plan cover the bills that they thought would be covered. And almost 10% of patients were turned away or unable to get a specific treatment because of insurance issues. This is not just an issue of the uninsured. One of the things that we believe is vital in solving the access to care issue is to make sure that proven prevention and early detection strategies become available for everybody in this country. We've demonstrated in colon cancer, in breast cancer, and in cervical cancer that through screening of individuals with no symptoms prior to symptoms developing, that if the cancer is detected that way, we can either prevent the cancer in the case of cervical cancer, or in breast and colon cancer, we can achieve close to 100% cure rates for screen-detected cancers. On the flip side, when individuals present without screening or diagnosed through symptoms, the likelihood of cure plummets to 25% or less. Adequate health insurance means timely access and coverage of the full range of services: prevention, early detection, diagnosis, treatment, survivorship care, palliative care, and end-of-life care. That's adequate health insurance. The second A is for affordable. This relates to the total out-of-pocket expenses, the premiums, co-pays, deductibles, that individuals with disease must pay in order to get their much-needed cancer care. To be affordable, it has to reflect a family's means, their ability to pay for care. The third A is availability. Availability means that coverage is available regardless of health status, that the policies are renewable, and that the coverage is continuous. And the fourth A is administrative simplicity. This means that we must have clear upfront explanations of covered benefits, financial liability, billing procedures, and processes for filing claims that are clear to the families, to the healthcare providers, and that make this care available to all. In order to put these principles into action, we've developed threshold questions and an evaluative tool. Here are the threshold questions. Does a proposal, now how would we use these? As proposals come forward, and we believe that they will in the year or so to come, and we've already seen progress on the state level, that we will use these threshold questions and evaluative tool to evaluate those proposals. So the threshold questions: does the proposal contain the essential ingredients: availability, adequacy, affordability, and administrative simplicity? Does the reform plan reduce or eliminate the ability of insurers to cherry pick among applicants? And is the overall proposal financing realistic and adequate to sustain the proposed reform? We've also developed a more detailed evaluative tool that can be used for individuals who are responsible for shaping healthcare reform proposals, or can be used to evaluate those proposals which come forward. Today we launch our public education campaign that will consist of advertisements and a much more rich website development. You're going to see our ads, which air for the first time today, in just a moment. I'd like to talk to you just for a second, though, about our website, which will consist of 3 steps: learning more, speaking up, and taking action. In Learn More, individuals who log on to the website will have a chance to read more about the access issue, find out how it's impacting America and how it's impacting the cancer problem. By clicking on Speak Out, visitors will be given the opportunity to share their personal stories and to give their own opinions about how to address the access problem. For a review of the Take Action section and related grassroots activity in support of this campaign, I'd like to cede the podium now to Dan Smith, who's president of the Society's sister advocacy organization, the American Cancer Society Cancer Action Network.
Thank you, Rich. As John Sefrin mentioned at the start, the public education campaign we are launching today serves as the nationwide call to action for change in our healthcare system that gives all Americans access to quality healthcare. Our goal is to help frame the debate and create an environment in which the new president, regardless of party affiliation, will be compelled by a national mandate to make improving access to care the first order of business in his or her administration. A critical part of this call to action is engaging the public, and as Rich mentioned, we will educate Americans about the full scope of the healthcare crisis through the Learn More section of the website, as well as encourage them to speak out by sharing their stories and opinions in that part of the website. We also hope to motivate them to get involved in the nationwide movement for healthcare reform. And the Take Action button, which will be on the website, and you show it up on the screen, will allow visitors to do just that. By linking visitors to the American Cancer Society Cancer Action Network website, known as acscan.org, we will be providing them with opportunities to call on elected officials at all levels of government to make access to quality care a top priority. Cancer advocates will also be invited to sign an Access to Care petition that will ask the candidates for president to make the access issue a top priority in their administration. And these petitions will be delivered at an appropriate moment during the presidential campaign to the candidates themselves.